There's one common event that we will all face, our own death. Yet how often do we truly engage with this fact, and what are the implications of how we live our life? Opening up the conversation about our own death while we have the space to do so is the focus of this week's guest, Nicola Adams. Nicola, an intensive care nurse, talks about her own direct experiences of death through her own life and work as an ICU nurse, and the implications of not facing this beforehand. She also talks about her own relationship with death and how she personally moved from not wanting to be here to wanting to enjoy life to its full. This is an easily accessible and far-ranging conversation with a wonderfully engaging lady. Whether you believe we go on after this life or think that this is it, the conversation challenges you to consider how you want to die and how settling on your own truth on this matter can actually reduce fear and bring a sense of ease to your life. So enjoy Nicola. Hello and welcome back to WA Real. I'm your host, Bryn Edwards. Death and dying and passing over is what we'll be exploring and deep diving with my guest today, Nicola Adams. Nicola, welcome to the show.
Hi.
So, one of the questions I always ask at the start is people's connection with WA. Now, you don't actually live here, do you?
No.
You're here over on a trip from Sydney.
Yeah.
To see good friend of the show and yourself, Tash.
Tash Kelly.
Yes, who we had before. Do you come over to WA often?
Probably once every couple of years or a year and a half. I usually try and get over to see Tash when we are particularly excited about the stage of our lives and looks like there's a big shift coming. We usually try and get together and do something.
What? How do you feel the vibe here in Western Australia? What do you enjoy? What do you pick up?
Whenever I come over to, I've only really come to Perth, so if I talk about WA, I'm really only talking about Perth. But it always feels expansive. When I come over here, it feels expansive. There's a lot of space, and also metaphysically, like the white noise, there's much less. I feel like you can find your own resonance much more easily because it's silent here. You can tune into yourself. You can hear your own thoughts, and so people tend to sort of find their essence and create things more easily.
Do you find that more here than you do in Sydney?
I find it for myself that often if I'm coming over here and I've planned something, and if I think about it when I'm in Sydney, it just feels too much or too scary or too big. But then I come here and I just do it, and it's so much easier once I'm here.
Yeah.
And I wondered about that quite a bit, but I actually had a reading from an astrocartographer lady, and she was looking at the charts, and she said there's actually, whenever I come to Perth, there's a lot of sun in my chart, so it turns me into this more of a warrior aspect than when I'm over east. So that's probably why I feel less intimidated or shy.
And what else do you pick up here as well? What about the people and?
Well, people are very generally very down to earth, approachable, warm, and I think they've got less walls around them, so it's easier to get to meaningful conversations quicker.
Right.
Yeah.
Right. That's fascinating, that is.
Maybe it's because, I don't know, but it's hard for me to really contrast because I don't have to go to work when I'm here, generally.
Yeah, it does have that holiday.
Obviously I feel more relaxed, but sometimes I do have things that are kind of worky, and it always just feels much more relaxed than when I'm in Sydney. Yeah. I think people are definitely busier in Sydney. Yeah. You've always got to get to work, or they're coming back from work, or...
There's a higher volume of people, high density of
Definitely.
people.
Yeah, but also the land is, Sydney's down and in. I don't know what you call that, but the energy tends to get stuck. It comes down and in. That's why the heat builds and the pollution builds as well. So you get these brilliant red sunsets, but yeah. So I think it's probably fresher in a way.
So as I looked across your journey and your story that you provided with me beforehand, we'll get more into it in a second.
Yeah.
There's a strong sense of seeking beyond the veil of life.
Yeah.
Where does that come from in the Nicola journey?
Well, if I want to answer really honestly what comes to me,
it is a real problem.
I think it comes from the womb, because I did not enjoy being in the womb when I was in the womb.
Right.
And I do have memories, but it's not like, it sounds really bizarre, but it's not like I always could remember being in the womb. It's more like I had certain situations where I felt really uncomfortable and I didn't know why. Like, if you're in a sleeping bag or something and you feel like you can't move your arms or legs, I used to hate that feeling, and I would feel so nervous. And then, I started doing these meditations and people say, you're in the womb, and, you're supposed to go into this deep feeling of relaxation and bliss. And I used to be, oh God, I don't, don't put me in there. It's horrific. So, and then a couple of times these memories did just come back to me in the middle of doing things, usually in the bathroom, because we talked about this before, and they're normally my moments. And I would just remember, I'd have these certain memories, and I remembered not being happy in there. My mum wasn't particularly happy about being pregnant. She was quite worried about it. Her marriage wasn't going too well.
Did she share this with you?
No, I
You just knew?
I just knew, yeah. And then later on I talked to her about it. And she was quite anxious, and she used to get a lot of headaches, so she used to take a lot of paracetamol. So all the time. And every time she used to get angry, and every time she had a really strong emotion like anger, I used to get waves of it. It was it's very toxic when you're in the womb. So I was constantly getting hit by these. And then the paracetamol was also very strong. So I was in this environment that was just really uncomfortable. And then, and my mum's very lovely. I have a really lovely relationship with her, but she definitely wasn't a person that was into meditation and conscious birthing and stuff, when I was coming through. So, and I would have chosen all that for a reason. And then, as I was coming through, about to be born, I don't think anything happened physically, but I really changed my mind. I remember thinking, I do not want to go there. I don't know why I decided to do this. I don't know what I signed up for, but I don't want to get in. And I tried to turn around, and I actually had this conversation with Spirit, and it's always confused me about free will, because I still don't really understand what the purpose is for me behind the meaning. But they said, you can't stop now. It's not possible, which is strange, right? They said the momentum is too strong, and you just got to keep going forward. You can't come back. And so I was born. And everything after them was a kind of, I guess, was a seeking for me of, what does this mean? Why am I here? Because everything when I was growing up, I couldn't find any meaning or purpose in anything that people were doing. No one was happy. No one was being honest about what was happening for them, how they felt. No one was saying what they were really thinking. And no one was happy, and they were had these lives, these priorities that were driving them forward that meant absolutely nothing to them. And it was just depressing. I just couldn't.
You saw that
I couldn't
at a young
understand
age.
why. Well, I could feel it, because I could feel what people were feeling, but I could also see what they were trying to project. But I didn't. I just thought everybody knew that, so I found it really confusing. Why do people do this and that, and why do people pretend to like someone that they really feel afraid of, or all those kind of things. That now I understand why people do things, because now I have a, an older person's perspective. But so I was seeking purpose, meaning, and pleasure. All of those things that, And initially I was seeking them externally. So that was a really good driving force for me to go travelling a lot and just keep seeking. But although I was seeking them externally, I was also seeking them internally, but in other people, not in myself, like watching I was seeking people that had meaning and purpose in their lives.
Right.
And trying to see, how could I put that into my life? How could my life be like that? Instead of
there was a thread you were following.
Yeah, instead of going internally and meditating and finding out what's me, what do I want, what gives meaning to my life, I thought I would find it by understanding a myriad of other people and what they did, and if they were happy, why, and things like that.
So it's fascinating that, because you're the first guest who I've ever spoken to who suddenly talked about their birth. In fact, I think you're the first person I've ever related to. And
right.
I suppose as I sit here and I listen to you, it's like they are memories.
They are.
They take a lot to access.
Yeah. And they're in our body, even if they're not in our mind.
Yes. I had a guest a few weeks back, Richmond, who put forward the fact that our subconscious is in our body, not necessarily in our mind. So that would stack up.
Yeah, and I would say it's probably a combination. And so it's more like, continually dialoguing with our bodies, because we do have this idea that we, being us, well, I think we have our body, we have our being, and we have our mind, and we tend to think that the mind controls everything, and that the mind will make decisions for the body all the time,
Yes.
But if you just stand in the supermarket and ask your body, like, what do you want to eat? It's generally different from what you think you want to eat, Or even what
you're heading towards the vegetables, not the processed food.
Yeah. Or even what do you want to wear today, Because your body could choose to like, oh, that's really weird. But when you put them on, you just feel comfortable.
Yes.
And that's,
That's so true.
Yeah.
So if we fast forward to now.
Yeah.
So you are an ICU nurse.
I am, yes.
So
always surprises me.
That's reassuring.
Yes, I am.
Yes, you are. So, first off, what does an ICU nurse, intensive care unit nurse, do?
Well, it depends what kind of unit you're in and what they specialise in. So we are not a major trauma unit. So we don't get, everyone, we see ICU and people think, oh my God, big car crashes, etc. But we we specialise in brain.
This is over in Sydney.
Yeah, in Sydney. Yeah. So the hospital that I work at specialises in operations on the brain.
Yeah.
So we tend to get a lot of strokes, brain bleeds, hemorrhages, aneurysms, those kind of things. And then we also we have a unit that's really good, specialised in spinal. So we get a lot of people that have been instantly paralysed in some form or another. So it's really intense, and they're the hardest ones for me. And then we get cardiac arrests, especially out of hospital cardiac arrests. And so generally what we're doing is keeping people alive who otherwise wouldn't be able to still be alive
by themselves.
Without medication and then a lot of them the ventilator for breathing. And some of them, we even have machines now where you can, it's kind of like an external set of lungs.
Right.
So
you know how to breathe.
Yes, there's all different technology coming all the time. It's pretty amazing. And sometimes we'll dialyze, so then the kidneys aren't, the kidney work's being done externally as well. We haven't got a brain yet, but I'm sure it's coming. External brains. Things that can work out what you would be thinking and then translate that. They're coming. Or if we're not keeping someone alive, then we are assisting them to die. But it's more common that we are keeping people alive. Yeah.
So what does a typical day look like?
Well, they're 12 hours with one patient, and it depends what's happening with that patient. But, if they're really critically ill, then you have to keep your eye on them all the time, because the medications that we use to keep their blood pressure up enough to perfuse the major organs, the heart and the brain, they have a really short half-life. So if that runs out, you've got half a minute, 1 minute before the patient's going to start crashing and have a heart attack. So a lot of it in the ICU is being prepared, thinking ahead, always being a couple of steps ahead of yourself, so that whatever happens, you're ready. You've got the medications ready. You've got to check your equipment every morning, make sure the ventilator's got spare batteries just in case the electricity goes, anything like that, because they can't survive on their own. And then you have the family and friends and loved ones. You want to
be there.
You want to give them time. It's a really tricky time for family, because there's this person that they really love, and it could even be their last moments with them. But they have to sort of hand over the responsibility for this person's life to us, because, we have to do all the clinical stuff, and it has to be done, because if it's not done, they're going to die. So it's really difficult for loved ones.
What's the general working atmosphere like? Is it quite calm and focused?
Yeah, I think it's
up tempo.
It's kind of like the opposite to ED. The emergency department's very chaotic. You don't know what's coming in. Everything can be everywhere. But the intensive care is very we always try and keep. We're always trying to be ready, prepared all the time. So it's much calmer, even when there is something, an emergency going on. There's always this, we try and practice it before it happens. Everyone knows their roles. There's this idea that the best way to be calm under stress is to feel like you know what you're doing and it's okay. And, so everyone will have a role. You'll have a leader. And the leader's not even necessarily a doctor. Sometimes it's the most experienced nurse there. It's just whoever is the best person to be in that role at the time will step into that role. So
how and why did you get into it?
I got into it because I wanted to get a visa to stay in Australia.
Oh, right.
Yeah, so I went and did a degree in nursing because I thought it's a really good way. But also I was already into holistic healing, and I wanted to deepen my knowledge of anatomy and physiology and pathology. So I thought, well, this is kind of killing two birds with one stone. Everyone in the field, like Barbara and Brennan, people who I really was inspired by, they had some sort of scientific training, and it really added depth to their message and what they were saying and their understanding. So I thought, well, nursing would be perfect for me because I would get some of that, and it's 3 years, it's not like medicine.
Yeah.
And I was already 37 years old. So I went and did the nursing, and I was really against Western medicine at the time because I was quite narrow-minded. I thought it was, this negative thing.
Was it almost rebellious against?
Yeah, I think so. Yeah, I was one of those people that thought it's so different being outside a hospital and judging it to then going and working in the system, seeing how hard everyone works and how much they care, and especially when you grow up in England, you really take the NHS for granted.
Yes.
And you can just be so, judgmental about it. And then when you're inside it, doing it, you just realise it's amazing and everyone is really putting their best in, and it's a massive undertaking. Of course there's going to be people who are going to get infections in hospital. Of course they're at their sickest. Their immune systems are down. It's like
the statistics will say.
Yeah,
the law of
I mean,
averages.
it's they're not there because they're healthy and strong, and and a lot of people are on their way out. They're in their 80s and their 90s, and then we operate on them, and then they they get a post-op infection. They're in their 80s and 90s, and then people say, oh, well, he had an operation, but, he got infected and the infection kind of killed him. And it's like, then it's suddenly the fault of the hospital. It's like, what's, way up the, should you have the operation? Should you not have the operation? What's the quality of life? And these are the chances,
I think also one of the things that came through there was, it's humans looking after humans.
Yeah.
It's not gods looking after
exactly.
humans.
And you come, whenever you go into healing, your own healing, you bring your own attitude with you, your own thoughts, your own understandings, and wherever you're at as well. So I think people often they want to hand over the problem to the doctor.
Yeah.
And not take responsibility for that part of their lives anymore. And the thing is, I also think that we've got into this catch-22 where the medical profession is very uneasy about saying, I don't know. So instead of just saying, well, actually, I don't really know. And it's not because it's not even ego, it's like fear. They haven't even been trained that it's okay to say, I don't know. We all get afraid of that. I get terrified, that I might be doing a training or something and, energetics, and someone might ask me a question, I might not know the answer, and then I realize, well, that's fine. You just say, you say, I actually don't know the answer to that. It's a great question. Maybe we can tune in and see what comes through, but, they're supposed to be this big professional body that knows everything about, and we can't.
Put them in this place.
Yeah, and they have allowed it to happen as well.
True.
So now we're in this struggle of,
This is why we hear of, surgeons getting God complex and stuff.
Yeah, like to just turn around and say, because I think if you think you know everything about something, then, you've already got a problem because it's not possible. Like everything is this fractal pattern, the deeper you go in, the deeper you can go in.
Yeah.
It's never going to end. We're never going to, we work what's an atom, and then you go in and it's this, that, and it's that, and it's that, and then at the end it's space, but then what's space? Space is packed with potential. I mean, it never ends, right?
It doesn't.
So, yeah.
So when did you first begin to reflect on death?
Well, I guess I can't remember ever thinking about death much when I was really young. But as I I guess it's more when I got into my kind of probably late 20s and 30s, I started to really... It's a funny thing is I've never been to a funeral. Never in my life. So it's really interesting. But I guess that was probably the times. And, I did travel in India, and just being in India, death is like everywhere.
It is.
Yeah. So you're just like, wow, we live and we die, and, you really start thinking about it. But I guess I did get to a stage in my life where I was wishing for death.
Your own?
Yeah, and it's not that I was consciously suicidal, because I didn't even realise that I was asking to die. It was kind of just like a program I had running in the back of my mind, just constantly. It was just like this whole intentionality that I had of, this is horrible, I don't like this, I want to get out. You know? And I used to have this idea that death was going to be this great escape, that I was going to die and suddenly it would be wonderful, like heaven, I guess, but not with the images of churchy heaven.
Yeah.
But this idea that, I was going to die and then I'll be free of this physical body and it would be amazing. And and I just ended up in a circumstance one day where I was had this thing running through my mind, and I really want to die, and I didn't know that it was running through. I was just so depressed. And then, because I do have conversations with, spirit or entities out of body, whatever you want to call them, they said to me, I was on a table because a friend I kind of gone into a bit of a trance, and a friend had put me on this massage table to do some Reiki to try and, because I was not looking very well. And I was kind of just not really present. And then I heard spirit, and this spirit said to me, do you really want to die? you know. And I said, yes, I want to die. And they were like, okay, come on then. And the next minute, I'd kind of just flown out of my body. It was so fast. I think it was probably all of 2 minutes, but a lot happened for me. And at the second that I was out of my body, it just felt disgusting, like the environment that I was in, because I was straight into my mental body, my emotional body, but without that barrier of the physical body, so I could feel it so clearly, and so, you know, I was in it. So, and it was disgusting because I hadn't done any, you know, I was just surrounded by depression and anger and all of these heavy emotions that I was picking up all around me. You know, I wasn't even noticing. Like, of course there were people around me that were joyful and happy, but I wasn't even noticing that. Like, I wasn't even open to that kind of resonance. So I was just surrounded with my own grief, my own sadness, all this sadness and depression that I'd picked up off other people, and none of it was completed. I hadn't faced any of it or worked through it, and it was all there, and I was sitting in it. And it felt like the thickest, deepest, sludgy tar, and it was revolting. And immediately I was just like, oh my God, get me out of here. I want to go back. Like, just get me the fuck out of here, you know? And they were laughing. Spirit were laughing. They weren't laughing at me. They were laughing with me because they'd known that that was going to happen. That's why they brought me into that moment, you know? And they were like, okay, and the next minute I was back. And that day I kind of made this decision, oh my God, I'm going to do this stuff while I'm alive. You know, I'm going to look at all this stuff, I'm going to clear through all my emotional garbage, I'm going to get my own energy space into a good space so that when I do finally die and transition, you know, it's going to be a pleasant experience for me because I've already looked at this stuff. I've already started completing it while I'm alive, you know, so that when finally I get to sit there, of course there's going to be stuff. I'm never going to be, you know, done or whatever, but I'll be able to hold my own in it, and I'll be able to stay focused and stay present and understand it and just get the richness of what it's teaching me at the time without being overwhelmed by all of this stuff that I didn't face when I was alive. And so from then on I started looking at death, looking at practices to die consciously, right, things like that. And also because I was always asking Spirit, you know, teach me more about death, about the transition. And then one day they said, we're not teaching you anything else about death until you start looking at life and birth, and, you know, because they're the same thing. You're going into that narrow-mindedness again. So, you know, until we see you embracing life and birth and things, we're not going to teach you any more about death. So then I kind of put my focus on creating a life of joy and looking back and looking at my life and seeing what happened. And then I started to see that I'd had this trajectory of being really involved with death the whole time and learning lessons about death the whole time. But I hadn't realised, like, I had couple of people around me that were dying that I was very close to, that I assisted with, and then I had
this is before this experience?
This is around the same time, actually.
Right.
I also had like animals, deaths of animals, which would always happen at really appropriate times and teach me things.
Is that during childhood and things like that, or?
No, during my travels around Asia, and I had a lot of often had best friends or animals, and then they would die, or, you know, and then they would teach me stuff when they were dying. And yeah, so I started to realise that it actually been a central theme of my life, but I hadn't really noticed it because it's when it's, you know, innate within you, you don't notice it, you just think it's normal. So I guess, yeah.
So how has that now manifested into what you do? Can you see how does it manifest and assist with what you do in like ICU and things like that?
Yeah, I hope so. I think it's starting to come in now. Initially, you know, I was so overwhelmed when I started working in intensive care. I came from orthopedics, surgical nursing.
Yeah.
Not in the surgery, but pre and post op.
Yeah.
And then I moved into intensive care because I've got just love learning, so I always just want to keep learning things deeper and deeper. And I thought, I wanted to go deeper into this nursing, so I went into intensive care, because that's, you know, a real depth of learning. And I was really overwhelmed with it. So initially it was very task focused, very clinical, very just learn what you need to learn to keep this person alive, like in this massive...
Learn to do the do.
Yeah, this massive responsibility of... And you're never really alone, because you realise after you've been there a while, or, you know, the thing there is it has to be group. We have to work well as a team.
Yeah.
Because if a patient's really sick, there can be 12 people looking after that one person at that one time. So, you know, as many as it takes is how many is going to be there. So we have to really work as a team. So I realise it's all, even though they allowed me to feel like I was on my own, because how else am I going to get my confidence and believe that I can do it? They're always watching me, and you know, and we have the flight deck in the middle, and that's got everyone's
flight deck.
Yeah, that's what we call it. It's got everyone's obs on it. You know, you can see everyone's heart rate, blood pressure, respirate, oxygen at all times. So you know, people, and so as soon as one goes a bit off, everyone knows, and then you know, they'll be like, is that patient over there right? So someone will come if you're out of your depth. But it took me a while to feel comfortable. But now I've been there about a year and a half, and now I'm starting to feel a bit more confident at letting my own sort of areas come out. I mean, I told them at the interview that I love palliative care, and that eventually I would like to move into palliative care. So they knew that about me. But I feel that now I can relax a little bit and start to use my own natural gifts, which is, you know, to really assist the family and the loved ones when they're making big decisions about, you know, the care of their loved one, like letting them go, allowing them to die. You know, the anxiety they feel around that, the grief. Because, you know, often they're making these decisions, you know, at the worst time to make them, and no one's had conversations about it before. You know, so... and one thing I've found is that in the majority of cases, people are always surprised when someone dies. You know, I mean, it's so weird. It doesn't matter.
Why is it weird?
Well, this person could be 90 years old. They could have been in and out of the hospital 100 times. They might even be...
Where does that surprise come from? Is it? Do you think it's from a wall that we put up between us and our death?
Yeah, I do. I think it definitely is, because then they're like... she's dead, she's dying. It's like, well, yeah. I mean, she's been dying already however many years. This is just the cases of people where you think it was pretty obvious that person's going to die in the next couple of years. Yeah. You know, that's what I mean. And people come, like, you know, and they're just surprised all the time. And I think there's a couple of things I think is that we're trying to do it now. We're trying to bring these conversations into people's lives earlier, because when you're stressed out, it's the worst time to try and understand a new concept or take on something else. But you know, it's to have advanced care conversations, advanced care directives, things like that, so that you know a person's wishes, you know how far they would like to go, you know what they do and don't want, you even know how they would like their funeral, or what they you know, even things like when you're dying, do you want someone to touch you, because everybody's different. Right? Or do you want music to be played? Because some people don't want music. Do you want to be in hospital or at home? You know, most people want to be at home. Most people die in hospital.
So we were saying the other day, a lot of people have birth plans.
They do, yeah. People will put so much effort into, you know, they'll go to yoga, they'll practice how they want the breathing to come out. And in fact, with birth, a lot of the thing is, if you're doing yoga with people, a lot of the thing is introducing the idea that when the birth happens, it might not be how they want it to be. Yeah. Because they're so set in this idea of how they imagine the birth to be and how they want this perfect birth, that we have to actually try and steer them out of, like, if it doesn't happen that way, you haven't failed. You know, whatever happens will happen, and you've done brilliantly, whatever. Because people, you know, but when it comes to our deaths, you know, which every single person is going to die, nobody thinks about it. Nobody talks about it. Nobody, you know, and it's like, and even if you ask people, what do you think happens after you die? I think people just, they haven't thought about it. And it's not that anyone has the answer, because nobody has the answer.
Yeah.
I don't have the answer. I have these perceptions and perspectives and ideas that have come together for me through my own thoughts and my own experiences and meditations. I can't say that they're true. I can't tell someone else that they're true, but I can say, this works for me. This makes my life a lot richer.
This is the T-shirt I wear.
Yeah, this
with death written on the front.
assists me with the idea of dying and, what's going to happen after I've died. I have experiences that I've had with people who have already crossed over, things like that, which, and whether or not somebody else even believes in those, they may not. So, but for me, those are very helpful. And if people do believe in that kind of thing, it's also very helpful for them. But, a lot of people haven't even thought about it at all. There's this idea, if I shut my eyes to it, it won't happen, but it is going to happen. And chances are it's not going to happen in the way we expect it to happen, or when we expect it to happen, or in the location.
Do we even hold any expectations? Because if you're not even engaging with the idea, what expectations do you think you're going to have?
I have, I have an idea of my best death, shall we say. I don't, best is not really a great, this idea of a good death and whatever. I don't particularly like that kind of idea. But, there's a lack of words around it. So I guess a quality death or something like that.
That's interesting what you just said there. A lack of words.
Yeah, we don't really have the...
One of the things I have noted... This just comes to me. One of the things I've noted in the podcast, every now and again I meet somebody, happens from time to time, and they expose a lack of semantics, lexicon, words around particular things. Most notable example is when I spoke to a lovely guy called Eddie Harron, and he deep dives into our relationship with time, and he has such a depth of vocabulary when it comes to time.
Yeah.
And now you've just exposed another gap almost.
Yeah.
We talk about, you're wanting to talk about what your best ideal. What's the adjective? What's the adjective that sits well? Meaningful, powerful, best, quality.
Yeah, meaningful is a good one. Because,
best version of.
Because why shouldn't your death mean something? I mean, for myself, there's a continuation of existence after death. So for that reason, I want my death to mean something. But even if you think that you're just going to die and that's absolutely it, wouldn't you want to make that meaningful too? You know what I mean? If you're only going to have one death,
I suppose. Actually, just sitting here thinking about it,
make it a profound one, for God's sake.
If you believe, like you rightfully said, nobody knows what happens afterwards.
Nobody
knows. We can have people who've, flatlined for a minute or so and come back and they talk about the light or this, that, and the other. But
we can, and that's not shockable, by the way.
Yeah,
like see on TV.
But technically, although you can say that person died and then they came back, they didn't die. Because it is a pretty. It is pretty black and white.
Yeah, and especially if they come back with a story, and there's been a continuation.
Yeah, but we don't know. And we never will until the day.
Know.
So you're right. Whether you in the camp of this is it and nothing's going to happen afterwards, or whether you're in the camp of it goes on afterwards. You're right. If you're in the first camp, then you should have this is just me and my value set, but you should have the most amazing celebration.
Yeah, whatever it is for you. Like if one of your big values is about joy, and celebrating with others and whatever, then sure, make that your best moment. What it's just, I don't think when I think that futility of it when people say, oh well, I don't believe in any of that, so I don't. Well, that's fine. It doesn't really matter. Like for me, the point is, if you have this thing and it's a great unknown and you don't know how you feel about it and you don't know what you believe, in that, when that gives you a certain sense of freedom then, because it doesn't really matter what you believe then, does it? You know, I mean, if you don't know and you're never going to know, then you may as well, then the choice is there. Choose whatever. My thing is, whatever's going to give your life the most ease and grace and integrity, choose that option then.
Yeah.
You know, so,
because that would probably
it doesn't matter.
Because that'll probably that feedback in and of itself will provide you with the story which is most integrated,
pertinent for your life.
For your life.
Yeah, exactly. You know, it's like, why spend 3 hours arguing about whether something's true or not?
Yeah.
Which achieves absolutely nothing.
Yeah.
You know, just decide which option suits you the best.
No full well that neither review will ever be able to find out.
No. And go for that, you know? So, yeah.
It's interesting. I've got another question for you in a sec, but it's interesting. It's almost what, as I sit here and think and be on it, that it's almost like, if you actually engage with it personally, engage with it and see what settles with you, then it can provide you with that richness of life. It's almost like the worst, and I'll put my bunny ears inverted commas up here, the worst choice would be to just push it to one side.
Yeah.
Because it's interesting sitting listening to what you've said so far, almost, you know, as you talked earlier on about, you know, in your childhood you couldn't quite see how people were with people that they didn't like, and they were doing things that they didn't necessarily like, and they might feel like this about something, but they're doing something different, and they're working in, you know, different lack of congruence between the two. Yet just cogitating on your own passing to me would align so many things in life.
Yeah, I mean, it's such a amazing thing to do.
What, cogitate your own?
Yeah, passing, you know, like, it just adds so much richness to every moment.
Give you so much strength and power.
I think so. Yeah.
What has been, obviously working in ICU, you will have encountered a number of passings.
Yeah.
Granted, we've already identified there's a lack of lexicon around this. What has been
the
most...
Well, I have to say that in my unit they do it really beautifully.
How do you mean?
The nurses around me and the doctors. I think...
How do you mean by they do it?
Yeah. That's even a funny term, isn't it? They do it.
Because technically they're not doing anything.
I guess...
The patient does it.
I guess what I mean is they... assist and support the patient and their family in a very beautiful way, with a lot of respect and a lot of, you know, bearing in mind that at the same time it's a busy place, and there are, you know, usually, you know, there may be one person that's passing away and then there's 10 people who aren't, so we've got to really focus on that. But at the same time, we'll always try and give the family as much, like a room to be in, and you know, there's as much support available as they want, but there's also as much space available as they want as well. So if they don't want us to be in there, they don't, and if they do, and it's just even learning to go and say, you know, I am here, but I'm not going to be here in your, you know, in the middle of it. I'm going to be out here, and then if you want me in, you let me know, and if you don't, then you let me know that you don't want me in. But I don't want you to feel, one, that I'm not available, or two, that I'm over available.
You're obligated.
So, you know, and then just this idea of, let's get the clinical stuff done, you know, as soon as possible, and then the things that we can involve the family in. Try and involve the family, you know, would you like to help us wash your mum, and, you know, all kinds of stuff like that, which often actually families say no, but we offer that, and we have like this program that follows up with the family after their loved ones passed away, and called the Loss Program, that one of our nurses brought in and has created and is researching and following through. So, you know, we do try and do it as well as we can for the families, but I still think that in our society as a whole, you know, it's still always seen as this very sad, negative time. You know, I think it's always going to be grief and sadness when someone dies. Absolutely. There's no way of, you know, that not being there. And why should that not be there? Because, you know, in fact, one of the families said to me the other day, you know, this is so sad. Like, how do you do this? Because they're all saying goodbye to their mother. It's one of the most beautiful things I've ever seen, you know. And she said...
Why was it beautiful?
Because she said to me, it's so sad. And I said, well, it is sad, but for me, all I see is love. You know, there was so much love in that room. Like, this woman was so loved and her life was so honoured. And, you know, in this moment of her passing away, all you could see was everyone just knowing in that moment, like it was really obvious to them how much they loved this woman, how amazing she was, how much they appreciated just having that time with her. It's so sacred and profound. It's every moment that we have with each other is a miracle, right? I mean, especially, you know, that podcast you did about time. I mean, time itself is not even a thing, right? You know, I mean, we think we've got time, but we don't. We just have this constant now of profound moments. And you never realize that more acutely until someone is transitioning out of our current present, you know? And then you're just like, wow, that's when people are really, you know, one of the things that's really meaningful for me in life is this thing about things being sacred, you know, and a lot of the time we walk around, we're taking everything for granted. We're not, you know, we just...
What does sacred mean to you then?
It means this, it's real, you know, it's just the integrity and the profoundness of everything. You know, it's just... you know, just being there in that moment and just the awe and the wonder of everything, you know, because everything is sacred. But of course, we're just human beings and we go through our lives and you know, we're cleaning our teeth or we're arguing with our neighbour or whatever. You know, we're not constantly aware of that. But at the moment of death, it's absolutely sacred, you know, and people are aware of that. And I think even, you know, even a traumatic death, let's say that someone dies in a car crash instantly or something, you know, of course there's no way that I can say this is truth, but for me, my perception of that is that the moment is still sacred and beautiful. Often when people pass over, even on the near-death experiences, they'll often come back and say, you know, I didn't actually feel any pain. You know, all these things happened, and the pain doesn't happen until they come back into their body. So I just, often when people are actually transitioning, there's such sacredness around that moment.
You were saying, you were giving the example before I questioned you after, you said there was a lady and there was full of love in the room. Yeah, and everybody just was so full of the love that they had for her, and it was there and it was so present, and that's all I could see. Of course they were all crying, full of grief, but they were crying because they'd had these amazing moments with this woman, and that's why they were crying, you know, and that in itself is a celebration. You know, it's like, of course we can feel grief, but grief doesn't have to be a negative thing. You know, it's another rich emotion. I mean, yeah, but I mean, grief, the message of grief is, you know, that something is becoming past. And you know, and that's what we're doing in that moment. This minute is completing. This moment is completing. This life is completing. There's a real beauty in that. And do you find that you see, certainly in the lead up, that many people want to have the conversation with their mum or their dad?
Well, this family, actually, this is another thing that was so beautiful about. I mean, I left there saying, I've just had one of the best days of my life, because they didn't have a chance to. Their mother, you know, it was very quick. Something happened, and it was a shock. It was very sudden, and then suddenly she was in the hospital and she didn't regain consciousness. So they, didn't have that time to sit around. Of course, they came and talked to her, but she wasn't, physically responding. She may have been somewhere, we don't know, but, she wasn't physically in the room responding. But she had been a lady, she'd been full of life, full of vitality, and she had sat down and very clearly told all of her family, she'd given them all an advance care directive, like, this is how far I want treatment. If such and such happens to me, I don't want treatment. I don't want life-prolonging treatment. So if something happens where there's no chance of me coming back and having a meaningful life, I want you to turn off any life support, stop any medications. They all knew that really clearly because she had told them. Now, I don't know how those conversations went at the time. There might have been, I don't really want to talk about that, Mum, it's not very nice. Or they might have embraced the conversation, we don't know. But she had the conversation, and all of those children were really clear on that. And the other thing was that she had put her name down to be an organ donor. So, and she had told them all about that as well. So they knew all of that. So, it took away a massive amount of anxiety for them at that time. So they could just focus on saying goodbye to their mother, how much they loved her. But they didn't have to go through this whole guilt and anxiety over, are we killing her? Because that's what people ask themselves.
Yeah, right.
Am I killing this person? And then, there's no answer to that because everybody's different. I mean, I can say, well, if it was me, I wouldn't want my life prolonged. If I'm going to be, always in a coma, but I can't say that someone else won't want that. So it was so beautiful to see a family that had that anxiety removed at that time. So I would love this to be part of our culture, that we do, and take the fear out of it, that it can be, there is a document now and you can change it at any time. It's not legally binding. So you can even think about it in your 30s, and then when you're in your 40s, you might feel differently. Every decade we feel differently about life. We think, and also when you talk to spinal patients who have been, who've had their lives changed in the most drastic ways, many of them are suicidal in the beginning, and then 1 or 2 years later, it takes them a long time to shift, and then
to a new reality.
And then many of them say there's so much fulfillment in their life, they love it, but we don't know. Some of them might not. Some of them aren't suicidal at all. So everyone is different, and you can't know how you're going to be. So I think this document that's just there for other people to know what we're thinking in this moment. If this happens to me now, this is what I would like, and this is where I'd like you to stop. And you can change it any time. You could review it every 2 years, every 4 years. Yeah. And they're trying to get them in the GPs now. So you go to see the GP, and the GP gives you it. And there's a whole booklet about how to start a conversation on it as well. So it's, I was going to say,
frightening. Technically the directive is the business end of it, but to get to that point, you've got to, go on the journey for yourself. You've got to go on the journey to accept and acknowledge that, to the place of doing it, and then to turn around to your family, friends and loved ones and go, right, you need to understand this, irrespective of where you're at in your journey. You've got to respect that I've been through this myself, and this is what I have written down. How do we get to the place of having these conversations more? One of the things that comes through for me already is that, you work in this this place, in this situation, the ICU unit. And you're very eloquent about this, and you've come at it from your own journey, your own seeking. Are these sort of conversations you have with your colleagues?
Well, even within the ICU, there are everybody has different skills and different abilities and different places that they, So there's some nurses there who, if someone's going to be palliated, they'd rather not be that nurse, and that's fine.
Palliated meaning?
Going to let them die. Yeah. Yeah. So what it means is that the focus of care changes from being one that is towards, life supporting to being comfort and care. So we just make them as comfortable as possible. Because a lot of the time when you are having procedures that are, working towards keeping you alive, they're really uncomfortable, really unpleasant. And if you're in the last moments of your life, then surely you actually want to be doing what you want to do. Like even before, it's a little bit different in the intensive care unit because people are at this, they're very sick. But even in hospital generally, on the orthopedics, when I used to work on the orthopedics, a lot of old people fall over and they break their hip, So then they're suddenly in hospital. And then they'll have an operation to have a new hip put in, and then they might get an infection or, so they end up having this long journey in hospital. Or people, one of the biggest ones is people with kidney failure because dialysis can prolong life almost. Who can say how many more years of life you can get on dialysis? But eventually the quality of your life goes down and down and down and down and down, And if you're at a point where, if you're in the hospital and if our focus of care is on prolonging life, then we will have all sorts of things in place. You might be nil by mouth. You might be on fluid restrictions, especially if kidneys are failing. You might be stuck in bed. Now, if you knew that you perhaps had a week left to live, you might want to go and eat your favourite food. You might even want to have alcohol, right? Yeah, you might want to do all these things. So you don't want this nurse coming in saying, well, you've already had half a litre today of fluid, so you can't have any more fluid. You definitely can't have, that whatever it is you love, that bit of chocolate over there. It's like this person is never going to jump out of bed and be totally well and go and whatever. So let's focus on these moments being the best quality they can be for that person. But we can't legally do that until the focus of care changes.
Right.
But,
And who makes that decision?
That decision is made with the patient and with the family.
Right.
So it's also best to make these decisions before you start to lose your faculties as well, because then we can't take your decision. Then we can't accept it because you're not mentally able, So it's good to have this stuff written down. Like I had to call an ambulance for my neighbour the other day, and he's quite elderly. And when we were there, he was very ill, and he was saying, I don't want to go to hospital, And then I was kind of caught in this dilemma because I thought, if he goes to hospital and he ends up dying in hospital, should we just be leaving him at home? There's all sorts of things involved in that. He lives on the top floor of the apartment. He can't really take care of himself. There's someone to come in, blah, blah, blah. But I said to him in the moment, is the reason that you don't want to go to hospital, is it because we'd already said to him, it's very possible that you'll die within the next couple of days if you don't go to hospital. So I said to him, is the reason you don't want to go to hospital, is it because you want to stay at home, even knowing that you might die, and you would rather that happen to you at home? Or is it because you think that you're okay and that you don't need the hospital and that you're well enough? He said, I don't need the hospital, I'm totally well. And so then we legally and ethically have to take him in.
Yes.
Because he's not well, right?
Yeah.
It was very obvious that he wasn't well and he was confused.
Yes.
So you need to think about doing these things when you can do them. When your word can be taken that I can't remember off the top of my head the proper legal jargon for it, but, when you're compos mentos and we can accept your decisions, yeah. And then the other thing is, eventually I would love to sort of shift this idea that we have of death anyway from being this awful, horrible thing that we have to go through to maybe being this beautiful, amazing, potentially transformative experience. But, I think before we even start going there, we have to just start having normal everyday conversations about death and how would you like to die, and, Yeah.
Which is not an easy one to bring up if you're sitting having a pint in the pub, is it?
No, and like, for example, my grandma, because I was thinking about my grandma this morning, and she died in her 90s, so she had a good life, she had a great life. But she got dementia, and, you know, she was in this home, and her dementia was getting worse and worse, and she lives in England, and I live here, so I wasn't really seeing her. But then, I mean, she was nothing like the woman that she used to be. But because she had dementia, she had gone past that stage where she could make decisions about what she was happy to kind of accept in her life. So I went home to visit my family, and my mum took me to see my grandma, because we used to go every day. And she was saying, she just kept saying, I want to go home, you know. And she was saying, my mum's there waiting for me, and her husband, who's also dead, you know. And everyone's like, oh, it's the ramblings of a demented woman. You know, she doesn't know where she is. They all keep saying to her, no, those people have already died. You're in this home. You live here. You're 90 years old, you know. And I said to my mum, yeah, that's not it. She actually wants to die. Because it just seemed really clear to me that she was saying, I want to die, you know. I want to go home like these people are. You know, of course, saying go home, that's a whole load of whatever. But this is just the language she was using.
Yes.
You know, I'm not saying it's home and we all, whatever, that's your own beliefs and things.
But it's easy for us to think home and then go, oh, bricks and mortar.
Sure, yeah. And I mean, for me, you know, I can think of it as this spiritual going home or whatever, but actually I used to think of it as spiritual going home, but now I think of it as a doorway into even more expansion and just another birth somewhere else. You know, I'm going to, when I go through this veil, I'll be birthed somewhere else. But you know, I said she's just saying she wants to die. She wants to go and be with her husband. She wants to go and be with her mother. They've all passed on already. But there was two things stopping her. One was she didn't feel she had permission to leave everybody, and two, she was afraid. So
how did you come with those two?
The first one I could just hear in her voice and the way she was asking. She kept saying, I want to go home. Yeah, I could hear that she just needed
someone to say.
Yeah. So we sat down and I said, well, you do know that you can go home, don't you, Granny? It's okay. You can go home any time you like. We're all really happy for you to go home if you want to. It's not a problem for us. We've all got our own lives. You're 90-something. It's totally fine. This is a demented woman. She was very still when we said that. My mum sat there. And then she went, she nodded her head. And then I took her out into the garden in her wheelchair, because it was a sunny day, and which is always beautiful in England. So, and there was a flower there, and asked the flower if I could pick it, because I always like to ask them first, because they can withdraw their energy then. And she said yes, and so I picked this flower and I put it in my grandma's lap while we were walking around, and then later on when I went home I took this flower with me and I put it on my pillow at night so I could connect with my grandma. And I did a journey with her, like she was asleep in the thing, but I did this metaphysical journey with her. And we went to the Vale and where you would cross over, and, you know, she was very nervous. She was really afraid. So I knew that was the second reason why she wasn't dying. It was because she'd never thought about death in her life. She had no idea what her own beliefs around death were. She had no idea what she was expecting or thinking might be at the end, because it doesn't matter what you believe in. You just need to prepare yourself for something. Yeah. Even if you're preparing yourself for nothing, for oblivion, you need a bit of preparation, and it takes away some of the anxiety. So, you know, she was very afraid, and she was a church-going woman, you know, that generation, and that, you know, their God was quite scary. He was this man. He was just a wrathful dad that would punish you, you know, if you did anything wrong. So there was nothing really particularly loving in her, you know, religious ideas or anything. So she was just afraid. So we just inched over a little bit, and then we came back and we inched over just a little bit. And because I was there, and then we just came back and we did that a few times. And then I came out of meditation and I said to my mum, she will die soon, you know. And I went back to Australia, and she died 2 weeks later. She was in her 90s.
Yeah.
And basically, my mum rang me up. She said she developed ischemia in her leg. It was extremely painful. She was in her 90s. Hospital offered to amputate her leg. You know, luckily my mum's realistic. She'd thought about death already, because some families would say yes.
Yeah.
And she was like, this is a 90-year-old woman with dementia. You are not cutting her leg off.
Yeah.
That is an extreme thing to do. You know, the hospital probably just felt they have to offer anyway.
Yeah.
You have to keep offering, you know.
Yeah.
And my mum said, no.
Yeah.
And they said, they were probably really relieved, like, oh
Yeah.
my God, we haven't got to operate on this 90-year-old woman. And they said, well, then we'll have to just go for comfort care. Said, yeah, that's okay. So they started giving her morphine, tiniest amounts of morphine. And I said to my mum, I just want to prepare my mum, because it's her mother, you know.
Yeah.
And I was like, be ready, because I knew, because I journeyed with her, that she had a little bit of fear, and that was stopping her. And I knew that as soon as she had a bit of morphine, morphine takes away your ability to feel afraid, right? It makes you so calm.
Yes.
So I knew that as soon as she had a bit of morphine, she would go over the bow.
Yeah.
And I said, just, you know, be ready, because she won't last long. And that's because some people, they can be palliated and they can last for months. You know, whatever each person needs, every death is so personal, so individual, you can't. Some people, you know, they want time, they need time. And they might be, you know, not conscious, but it could be months. But I just knew it wouldn't be long, because we'd already done this, you know, bit of preparation. That was enough for her. And 2 days, she was gone with the tiniest bit of morphine. So it's just...
All made sense.
Yeah, it's just that, you know, mental preparation, because we are so scared of the unknown. And it's never going to be the known, but at least it could be something we've thought about.
It's interesting that, you know, like even the little tagline for this podcast is find yourself in real stories. And one of the things after sitting and talking, you know, to over 100 odd people is that it's all about the stories we tell ourselves. We don't really know.
Yeah, we don't know.
We tell ourselves stories. We define ourselves by the stories we tell ourselves.
Yeah, we do.
And so what's the and I find that once people start taking responsibility for the stories they tell themselves, then they start creating the experience and the reality that they enjoy. Yeah. And what's shining through here is death is no exception, because we don't know the answer.
We don't know the answer, you know.
So why not fully engage with it, not fleetingly, mentally, emotionally. Go there, think about it, see what feels right. Whether you believe that's it, or we move on, or we reincarnate, or come back as a flower, or hop out of one and straight into another, or whatever it may be, but work out what sits for you and double down on that and embody that and honour and respect that story, and then when the time comes, you have your story, you have that you'll tell yourself about the experience.
And it may be absolutely nothing that you expected.
No.
But at least you've prepared.
Yes. And so then you've removed a huge amount of fear, which can pervade your entire life.
It's like Tash, on the way here, Tash was talking about Manifest, that festival that she created out of nothing. You know, and she said she was very... you know, she was having a moment where she was like, oh, it's not going to happen, you know, I don't know the first thing about a festival. And then 2 people came to her and gave her this list of contacts, people that knew how to set festivals up, knew how to do it, you know. And just because she had those lists, then she felt, oh, this is doable. She relaxed. She created it. She didn't use a single person off any of those lists. You know, everybody just came at the moment and the thing created itself, and it was amazing. So it's kind of what I'm saying about death. We don't know, you know, you can have any idea that you want. The same thing we were saying about birth. You don't know how the birth is going to go. So, you know, you can just have a little bit of preparation, because in that preparation is peace and calmness. And then you may not even, maybe nothing like you expected or you planned, or you may not use any of that preparation, but at least you've done it. And it gives you peace in the moment, It's because it's about now.
The word grace is coming through to me.
Yeah.
Having a graceful departure.
However that is for anyone, you know.
There's a fantastic, as I sit and listen and talk to you, there's a fantastic connection with life that you have. At its most finest, at its most undiluted. Is that how you feel?
I feel very still suddenly. Like I'm just... I don't even know if I want to say anything anymore. Okay. I feel like we've come to this real... Can you feel that?
Yeah.
We've come to this real beautiful... I feel like... Do you want to say something?
Oh, right. Yeah, I think for me, as I just said then, it becomes so abundantly clear when I listen to people on the other side of this microphone, that we do tell ourselves stories, and we go on games of hide and seek in those stories. And some stories are just too scary. We just don't want to go near them. And you can try and hide in other games of hide and seek to stay away from the one that you don't want to play in. But the one that you don't want to play in is the one that you'll have to play in at some point. And that's where you will have to face what is the story that... It's not the story that is categorically, objectively truthful. Because, hey, while we're here, I don't really think there is much in the way of objective truth. You know, and people of scientific nature will probably disagree with that. But, you know, ultimately, if I measure, you know, there's a piece of rubber on the table here. If I measure it to be 10 centimetres long, that's because I've used a ruler. And the ruler is a set of little lines that we've all agreed is that long. So subjectively, we agreed that all the little lines together, and the one big one with the 10 written on it, and we agreed that 10 is 10 as well. Right? So it's this false layer of objectivity.
That's so weird.
So in that, you know, it just gives you an amazing sense of freedom once you realise that you can construct your own story. Now, the thing I'm learning with that is, on the surface of that, yeah, you have the freedom to construct any story you want. But as I found recently myself, you can write the craziest story in the world. But even within the story that you choose to write yourself, there will be a resonance within it. And there will be things that you write down in your story and it'll be like, oh, that feels right. And that's, although it sounds exciting, that part, you know, egotistically, that is ego driven. It doesn't sing from my soul. And so, yeah, there's almost like a core signature within you that helps you to define the story, which is... I journaled this out the other day. I believe that stories have the stories we tell ourselves, the key core stories, and they are so deep, medium deep, surface deep, right? I believe that there's spirit underneath us, and that the stories have the ability to either amplify or muffle, de-amplify, if that's a word, the core energy that we have within us. And when you get the stories right, that are lined up with your core frequency, whoosh.
So that's kind of, yeah, and that's what we were talking about the other day, isn't it? Like when you can recognise your own resonance, your own integrity, then you can learn to recognize it in the stories that you're telling yourself, and then there's no right or wrong. There's only ever one question.
Yeah.
And the question is this going to make me more of who I truly am or less of who I truly am? Is this going to bring me into more integrity and expansion of myself, or is it going to take me away from myself? And there's your answer, And you can still take whichever path you like, Yeah. But what is your preference? Like for me, I want to take the path that, is going to increase my integrity of self. Yeah. But I just loved what you said earlier about, we're all telling stories. Nothing's right or wrong or true or untrue, really. We're all telling stories, but what comes out of it is once you start to take responsibility for the stories that you're telling yourself, then you can decide, then you can use the stories, can't you? That's what we were saying. And they can bring you towards a greater degree of integrity and self-awareness and self-knowing.
Purposefully go on a game of hide and seek to go and learn something.
And tell yourself those stories that really... Yeah. And if you want, tell yourself the other stories. It really doesn't matter. But then just, what are the consequences of each one and which one do you prefer? Yeah. That's all.
And which one is holds most integrity to you?
Yeah.
And so if we double back all the way around by actually facing up to the story of our own death, which is the story on departure, which is going to happen to all of us, not appeal. It happens.
100% of us.
Yeah,
absolutely.
How do you want to lead in? What do you think is going to happen? What do you think is going to happen afterwards? Investigate that story.
For me, what I want is I want to stay aware.
Yeah.
That's what I want. I want to stay present. I want to stay aware. Of course, I don't want to be in pain and stuff, but I don't believe that that's going to be, for me, however I'm dying, I don't think pain's going to be the big issue. Even if I've done something that's very painful, I don't think that I will be, aware of that. I had a car accident once, and it was a very lucky car accident, as in nothing physical happened to me.
Yeah.
But I had a completely different experience of what happened. So the last thing I remember seeing is a really long driveway and a set of French windows at the end of that driveway. And I remember thinking, fuck, we're going to break those windows. We're going to go straight through them. And we're going to break them. And then I don't have any memory. I know that I somehow got out of the car because I was laying in the middle of the road. So I don't know. I know I was laying in the middle of the road like this, the whole thing was just emotionally overwhelming. I was laying in the road and my partner came to just get me up and get me out of the road. And we went back home. We're living in Spain in the mountains. And the next day I said, we were at the pub because that's what everyone used to do. Everyone had gone over the mountain, drink driving where we live. They're all been there years. And, and I was sitting there and they said, how are you? And I said, well, I was still in shock. I said, I'm okay, but I'm really worried about that house. What happened to the house? Did we break the windows? Was there anyone in there? And they were just kind of looking at me. And then someone said, I think you should probably go and have a look at the car. And I said, oh, okay. And anyway, I went and had a look, so it was still there. And it was hanging over the edge of the mountain. Like there was no house there or anything. It was just, the car was just there and it was hanging. I don't even know how I got from my seat out because my door was hanging. So I just don't know. But what I do know is that, what happened to me in that moment was the easiest thing for my mind to contemplate without breaking. Was that, I didn't see that we were going over a mountain. I didn't see any of that. And, many times people do come back from extreme moments like that. People that lose their fingers and whatever, and you're like, how was the pain? And they say, didn't feel any pain at the time. We'll hear that a lot in the hospital. People have the most incredibly awful, traumatic things happen to them physically, and they say, I couldn't feel it. The body kicks in. We have, the pineal gland, that whole thing about, there's a something that's released when we die. I can't remember the name of it. This neurotransmitter, and that's what science is now trying to say is responsible for the near-death experiences and things. And I don't think that's wrong, but that also doesn't negate what's happening in that experience. The both can be true.
The whole body is a little chemistry set.
That's right. So I don't think that pain is going to be, of course that's what we think's our main fear about dying, but I don't think that's going to be the issue when we get there. I really don't. So for me, I would like to maintain my awareness, because the thing is, we learn to work out who we are so much by our bodies. And that when I had that mini experience where I lost my body and I came out, the next thing I identified myself with was my emotional body. So then I still knew who I was, because I had this awful emotional body. But when all of those things are breaking down, your physical body, your etheric body, your emotional body, your mental body, and they're all moving away, this whole construct of what makes your identity, there's still this you at the end of that.
Essence.
Your beingness, your resonance, your you. And if you can maintain awareness of that, you can follow your death through with consciousness. And then you do get to see what happens next. You get to hold it all, And there is, like the Tibetan people who, are the masters of death and dying. They have all of these chants that they do, and they intone them at the time of death. And the idea is that you hear them then, and that sound carries you through, and you keep your awareness as you die. And then you can decide, you can bring your memories through to the next life if you want to, or whatever. Yeah. So they have this whole, they have a whole wealth of knowledge on dying, because they're such deep meditators. So, the world is our oyster. It's all out there. You can, can just make your death your own.
What have you learnt about yourself through all of this?
I have learnt to live life and to love being me, and to embrace death, because it's just, it's an incredible opportunity having this life, and I want to look back. Well, I can already now. I'm at a point now where I don't want to die. I want to keep on living this life, because the life I've created is really joyful and pleasurable. And if I die, I've done so many great things that were important for me to do, that it's okay. I've had a fabulous life, and that's something that I think is, make sure that you've done things that you think are great.
You think are great.
Yeah, for each person, you know what I mean? Make sure that when you get to that point, when you're dying, you're not going to look back and be full of regrets. I wished I'd told that person I loved them, I wish I'd spent more time with them, or I wish I'd seen that part of the world. Whatever it is for you, do it. Face things, confront them, just keep on living.
What does the next 3 or 4 years look like for you?
I don't know. But, I think I'm definitely going to move more into being with people when they are dying through that time of life. We had a little conversation about this the other day about, I think it was you. Yes, what an honour it actually is, and what a privilege it is to be able to be granted that privilege to be with someone when they're dying, because when someone is dying, that's the most precious part of their life in a way, and the people that they have around them in that time are very lucky people, and I would I'd love to have the honour to be with more people as they are moving through that transition, and to because it's just such a profound time. I find it incredible, beautiful, and
it's not often I do this with guests where I give them firm suggestions, because I spend more time listening and but I can definitely see you holding space for people to actually consider their own passing. and and providing their own directive, and constructing their own directive, and constructing their own story, authentic story.
Yeah, because one of the things I would love to do actually is just to hold dialogues around it.
Yeah.
You know, it's just to sit in groups of people, circles, and just talk about death, which would eventually lead to what you were saying, I think, you know. Just
your own,
people.
Just to hold a space to be able to talk. You know, it's always like talk shit about life.
Yeah,
But so you find your own story that sits for you.
Yeah.
And then from that, then you can do the practical things of directives and things like that, and what have you.
Yeah.
What's Nicola grateful for?
Friends. I love my friends. They're such an important part of my life. You know, friends who I can have inspiring conversations with about the profoundness of life, because I really, I find if I can't talk about that stuff, I start struggling in life. So I'm so grateful for that.
That's why I created the podcast.
Yeah. And I'm really grateful for living in Australia. I love Australia. I love this country. I love the land. The land is so powerful here. I love connecting with the land here and the feel of it. And, you know, it was interesting because my mum told me once that my granddad wanted to come and live in Australia. You know, and they could have come over. They were paying people to come over them. And my grandma said no because she didn't want to go. And, you know, and my mum felt that granddad had been a part of the getting me here,
right.
to fulfill his own wishes in the genealogy, you know. So it's beautiful to be here. I love England. England's a really, really lovely country, and the more I go back there, the more I appreciate it. But when you're living there, I was blind to all of that stuff. So I love going back there now. I love being with my family. I appreciate them so much. I love the moments I get with my family when I'm at home. It's incredible. I'm going home for Christmas and I can't wait to just sit with my family in the cold. And have a Christmas at home, you know. It's going to be beautiful. So I'm really grateful for that. And I am so grateful for technology. I love the internet. It's just, I just love it. I find it so exciting because I just love being able to explore and seek, and you can just put a few words in and you've got no idea of the wealth of richness that's going to come back to you. So it's another thing I love. And I've got to say, I love aeroplanes. I just love travelling as well.
Superb. And the last question I ask my guests is if you could upload a little nugget of information into the collective consciousness so we all just get it, what would that be? It
would be a pathway to recognising your own essence and resonance, so that you can find it.
Well, there is a pathway.
There certainly is, yeah. And in fact, the fractology, which obviously we're not going to go into, but the healing modality that I do, we do actually get together and we join all of our minds into this group mind, and we do create pathways for things like that, and we put them into the collective consciousness. And we just put them there and we leave it open. So if anyone wants to reach for it, they can have it. It's there for them. But nothing's ever forced on anybody. We've done with integrity, always. So that's what I would do,
It's been an absolute pleasure to talk to you today, Nick. I know you were very nervous about coming in.
I know, but then I just talked
and
away.
It all came out of a small conversation over a cup of tea the other day.
Yeah. It's been, I really enjoyed it. It's been lovely.
Yeah.
Thank you, and thank you for your presence and for holding the space and for, just bringing that space about where things can just come out that, you know, who knows, somebody might hear it and think, that really helps me. Yeah, so thank you.
And if people want to find you, reach out.
Well, I am actually finishing my website as we speak with Tash for the fractology. So that will have a... do you do anything online? Do you put lines down? Do you write things down?
I do.
Yeah. So I can, because I think we're going to finish that today. So there'll be a website address then that I could give to you, and you could put it at the bottom of this podcast.
Excellent.
Yeah. Yeah.
There you go. Thank you so much.
Thank you.